Hello, good morning. Welcome to the Comagine Health weekly webinar series for long-term and post-acute care facilities to support the COVID-19 vaccine and booster rates. I want to thank you for spending time with us this morning. My name is London Manor Peterson, and I will be your presenter today. A few housekeeping items before we get started. Please take a moment to locate the chat feature in this webinar platform. It should be at the bottom of your screen. Feel free to share your thoughts, comments, and questions with all the participants. Members of our team will be monitoring the chat and will bring your questions forward during the moderated question and answer portion at the end of today's session. Links to resources will also be posted in chat throughout the presentation. Now that you have located the chat feature, we would like to know you, our audience. If you're joining us from a care facility, would you please put your name, your facility's name, and your role in the chat? This presentation is being recorded. The slide deck and recording will be available on the Comagine Health website following this event. And now let's get started. We know that you're facing many challenges with the COVID-19 pandemic. Misinformation has been a particularly challenging aspect of our current health crisis and something we're going to be discussing in our time together today. There's been a lot of false information that is circulated around about COVID-19. Not all false information is malicious in intent or purposefully spread to do harm, but some of it is. First, let's talk about different types of false information. Misinformation is false, but it was not created or shared with the intention of causing harm. Often people are trying to help, so they share information that seems helpful, but the truth is that information connected to health and medicine involves intensive research and complex science. Guidance might change as more research is undertaken, meaning even official guidance from a few months ago might be out of date. Disinformation is a particular source of concern. It is spread intentionally to serve a malicious purpose, such as to trick people into believing something for financial gain or possible political advantage. This is particularly alarming in the case of COVID-19. We've seen all forms of inaccurate and false information being circulated about COVID-19, from how the virus originated, its cause, its treatment, and its mechanism of spread. When we rely on friends or internet searches for the best information, we might inadvertently be putting ourselves in harm's way. Why does it even matter? Why don't we just ignore false information? Well, because disinformation in the context of the current pandemic can directly impact human health. When people are sharing misinformation, which can circulate very quickly online, it can change people's behavior and potentially lead them to take greater risks. All this makes the pandemic much more severe, harming more people and jeopardizing the reach and sustainability of our health systems. According to the World Health Organization, we are experiencing an information epidemic. They've actually termed it an infodemic, which is an overabundance of information, some accurate and some not, that makes it hard for people to find trustworthy sources and reliable guidance when they need it. It's when there is a large increase in the volume of information associated with a specific topic, whose growth occurs exponentially in a short period of time due to a specific incident, such as the current pandemic. In this situation, misinformation and rumors appear, along with manipulation of information and doubtful intent. Increased access to cell phones with an internet connection, as well as social media, has led to the exponential production of information and the number of possible paths for getting it, creating this infodemic. In other words, we have a situation where a lot of information is being produced and shared to every corner of the world, reaching billions of people. How much of this information is accurate? Just some. Daniel Kahneman is a Nobel Prize winning psychologist who is noted for his work on judgment and decision making. In his book, Thinking Fast and Slow, Daniel said, a reliable way to make people believe falsehoods is frequent repetition, because familiarity is not easily distinguished from the truth. This is why repetition is so powerful. If you've heard it before, you process it more easily and therefore are more likely to believe it. Repeat it multiple times and you increase the effect. So even if you've heard something has been debunked, the sheer repetition of the original claim can make it more familiar, fluent, and therefore believable. People may be exposed to misinformation through mainstream media and more through online social networks, which fuel the infodemic by amplifying disinformation. So the infodemic actually accelerates and perpetuates misinformation. We have seen attention-grabbing disinformation tactics motivate people to visit websites and social media accounts, where each visit to a website hosting an advertisement creates revenue for the owner of that website and the content on it, which in turn further promotes the misinformation. The Office of the U.S. Surgeon General has developed a toolkit for addressing health misinformation. They have identified for us common ways that misinformation is spread, and we will talk about some of those ways today, and I'm sure you'll be able to think of many others. These are some common ways that false information can spread. Media syndicates have been hugely scrutinized over the information they have shared, many losing credibility after sharing too many factually inaccurate stories. Often, when individuals share disinformation, they are unaware of the true source of a link or email they are sharing. But it's not just happening online. False information can be spread through really any form of communication. It can come in the form of false, misleading claims made in speeches, via pamphlets or posters, or in advertisements. It's common for people to think that misinformation doesn't impact them, but we are all vulnerable. These are some common ways that disinformation is shared. Memes are usually fun, colorful images or graphics that were created as a joke, but then people started resharing them thinking they were true. There are websites that can look professional, often designed to look like news sites, but the stories are all false or misleading, with sensational titles designed to make us click on them. There's cherry-picked statistics, where we often see people choosing numbers that support what they want to argue, but without all of the data, they haven't provided the true context. Then there are misquotes, which are quotations where the beginning or end have been deleted to change the meaning. The person did say it, but without the full context, it's not a fair representation of what they actually said. Misleading graphs or diagrams that can also look official but don't tell the whole story. And oftentimes old images are recirculated as if they were actually very recent. And videos can be edited to change the meaning and shared out of context. Why do people share misinformation? What's in it for them? Well, often we like to feel that we have new information that others don't know. And so naturally, we like to share this information that others may not know yet. So when it seems like there might be something new to report, people are excited to share. We also want to protect the people we care about. Often when people are asked about their online sharing habits, they will say things like, "It's true, sometimes I share things I see without checking first, but honestly, I feel that it's better to be safe than sorry." People may be seeking explanations or wanting to share information that helps to make sense of an event. But when we are unsure or frightened, we often seek and share information that can provide explanations without checking where or who it came from. And we want to feel connected to others. More of us are living alone and may feel disconnected from our local communities. But online communities are thriving, and unfortunately, some of the most active online communities are based around misinformation. In this toolkit, they have identified for us that there are different types of sharers. They identify the disinformers as people who deliberately create harmful disinformation, often because they have something to gain from it, whether it's political or financial or just causing unrest. There are hoaxsters who create hoaxes to fool people. Sometimes they do this to make money. Then there's your enthusiasts who post misinformation frequently in support of a particular person or cause. Your casual sharers tend to spend a lot of time online and can sometimes share carelessly while they're waiting in line or scrolling late night in bed. Oversharers see something online that seems helpful or worrying, so shares without checking because they'd rather people have as much information as possible. Believers are often deeply connected to an online community that is pushing false, misleading claims. They believe that the information being shared by the community is true and want to share it with others. And then there's your mischief makers. They create false or misleading information to see if they can fool people just for the fun of it. Whoever we are, we have people who trust us. So we all have an important role to play in addressing health misinformation. The toolkit has a checklist that they recommend people consider before sharing information with others. So stopping to ask yourself, did you check with the CDC or your public health district to see if there's any information available about the claim? Updated guidance and recommendations based on new evidence is an essential part of the scientific process. But when we find ourselves in new situations, such as the COVID-19 pandemic, it can be difficult to know how to figure out what to believe, which sources to trust, and how to keep up with the changing knowledge and guidance. The CDC and the public health departments are two sources that rely on the best evidence for their guidance and good places for us to look for ours. Oftentimes, misleading websites or posts include the logo of an established organization, like adding the CDC or a news network logo. Typing the claims directly into the search engine can help identify if it really did come from the reputable source that you thought it did. Be aware, it is very difficult to fact check someone who says, "This happened to me." Those trying to push disinformation will often deliberately create content that looks like real life stories from real people when it's all made up. Anybody can write or publish anything on the web, podcasts, articles, in particular on social media channels. Be sure to look up the general claim and not add name or state specifics, which will automatically pull up stories with those specific search tags. Many times websites that are hosting misinformation are easily identifiable by a misspelling in the web address or a shortened URL. Explore the page's About Us tab to help determine if you have reached an official site. Do you have a trusted health professional that you're able to ask questions of? If you are really concerned about something you have heard, try to talk with your trusted healthcare professional to understand from their clinical background what information they have for you or what resources they trust on the topic. False or misleading information about diseases, illnesses, potential treatments and cures are causing people to make decisions that could have dangerous consequences for their health. False information can spread through communities, within families, and between friends, often who are just trying to help. So they share information that seems helpful. But the truth is that this information connected to health and medicine is complex and evolving. Remember that guidelines might change as more research is undertaken, meaning even official guidelines from a few months ago could be out of date. It's best to keep to the rule of, if you're not sure, don't share. So addressing misinformation that we see online is one thing, but I'm sure at this point we've all experienced misinformation being shared in conversations with our family, friends, or coworkers. This is concerning because we know that disinformation may influence some people's vaccination decisions. Behind the noise of disinformation, there are many people with valid concerns and questions that must be heard and addressed. How do we have a conversation and address the misinformation we hear without causing an unpleasant encounter? According to the toolkit from the Office of the U.S. Surgeon General, the best way to change someone's mind about misinformation is to listen. Listen to their fears and why they believe what they do. We do our best not to focus on the content or the false claim, and instead focus on the broader issue and how they feel about the issue. While sometimes it's tempting to fact check as proof to someone that their information is wrong, this approach can often shut down a conversation. For example, if you're talking to someone who is worried about the potential side effects of the COVID-19 shot, ask them what side effects they're worried about and listen to their answer, instead of telling them they have no reason to be afraid. After you have listened, you could offer to help them find a trusted source for more in-depth information, making sure that they have the most informed decision. It's also important to empathize when talking with a family or friend. Highlight the fact that you understand why people find it difficult to trust certain sources of information. Ask questions to understand where they're coming from. Admit that you have struggled and struggle still with knowing what is true and false, and figuring out who to trust in terms of health information available online. And where possible, talk about times where you have fallen for misinformation and explain why you were susceptible and share what resources you found that helped. Underscore that finding accurate information can be hard, especially during events like the pandemic, when the information is constantly changing, which will always happen with a new virus or disease. Emphasize the need to find credible sources who are not in a position to personally profit or to gain power or influence when seeking information. Remind them that an expert on one topic might not be the best expert to turn to around another topic, and share what resources you have found to be reliable. Where possible, try to have conversations one-on-one, either face-to-face or via direct messages on social media sites. Remember, no one likes to appear wrong. Having conversations in the comments under a post has the potential to backfire, or means more people might see the misinformation. A caring tone of voice could help more people. Be gentle in your replies and remember to listen and be empathetic. So we've discussed tactics for talking about health misinformation. How do we actually address it? Is there a true, tried process that works? On the CDC's webpage for addressing COVID-19 misinformation, they've created a graphic modified from UNICEF's field guide on addressing misinformation. You lead with the fact, make it clear, relevant, and memorable. But watch out, there's a false information alert. The fallacy or false truth could have stemmed from misinformation, which, as we talked about earlier, is unintentional, or from disinformation, which is intentional. And this is where we can flag deceptive tactics, share distrust of the author of the disinformation, and highlight the misleading tactics they use, and try to reveal their hidden agenda. You follow this up with correct information. Share where you learned the fact and why you trust the source. Repeat the facts so that they stick more than the disinformation. The CDC gave us an example of how you would use this process for addressing COVID-19 misinformation. Here is an example. This is a fact. The COVID-19 vaccine will not make you sick with COVID-19. But warning, here's the misinformation alert. Because vaccines can cause mild symptoms resembling those of the disease they are protecting against, there is a common misconception about this fact. The fallacy. Some people are saying that the COVID-19 vaccine will give you COVID-19. That is not true. While you may feel sick after getting the COVID-19 vaccine, that is a sign your body is building protection against the virus that causes COVID-19. where symptoms do occur, the vaccine recipients are experiencing a body's immune response to the vaccine, not the disease itself. Fact, the COVID-19 vaccine cannot make you sick with COVID-19. COVID-19 vaccines teach your immune system to recognize and fight the virus that causes COVID-19. Sometimes this process can cause symptoms, such as fever and chills. These symptoms are normal and are signs that the body is building protection against the virus that causes COVID-19. So we have talked today about how to identify misinformation, learning from the toolkit created by the Office of the U.S. Surgeon General about the different types of health information and the different types of people who share health misinformation. We saw the misinformation checklist to remind ourselves not to be a part of spreading health disinformation, and discuss the most effective methods for talking about misinformation with family and friends. We learned about the infodemic from the World Health Organization and how incredibly challenging it can be to wade through the vast amounts of misinformation out there. And we learned from the CDC a process that we can use to play an active role in addressing vaccine misinformation. The guidance is still changing on the most effective methods to protect ourselves from this disease. Keeping ourselves updated and informed will not only help us, but those we engage with as well. Thank you for your time today. I will pause now for questions, or if anyone has any stories about misinformation that they've encountered and maybe how you've addressed it, we'd love to hear you share.
Currently, there are no questions in chat for you, London.
That's all right if you don't have any questions. Just curious, what's some of the more common misinformation that you've heard about the COVID-19 vaccine? That's all right if you don't feel like sharing. I just thought I'd throw it out there. I know that I've heard lots of random misinformation facts from people, and it's been a challenge trying to address it for sure. Oh, thank you, Tip. The vaccine gives you the disease. I think that's very common, right?
This is Donna. London, I want to thank you for how you presented that whole thing about addressing the misinformation, that toolkit. I had not seen that, and I think that that's something that could be very interesting to try to use in conversations with people. Do they have other examples, or is that the only example that they provide on their website or toolkit?
That's the only example they have related to COVID-19.
Okay.
Mm-hmm. Oh, Paula, I see your comment about causing infertility. I've heard that one, honestly, very often. In fact, heard that probably 6 months after the vaccine came out. And so I was so curious how they possibly could have related the vaccine with infertility, because you didn't even have enough time to get pregnant from the time that the vaccine started being, given to the public. So that one has definitely been circulating around for a long time, and never know about those origins. Well, I thank you guys for sharing. I thank you for spending your time with us this morning. We do have a team that works with the nursing homes in your area. These are your contacts for whichever state that you're in. Please feel free to reach out.
Do we have a poll, London?
Oh, thank you, Edie. I had absolutely forgotten about the poll. I appreciate your reminder. I do have a poll. If you found today's information helpful or relevant, please take our poll, share with us. Any feedback you share is helpful as we continue to make educational content available for you.
Real quick, while people are filling out that poll, I want to share something that director of nursing at one of the centers shared with me a piece of misinformation that she heard was that there were microchips being inserted into people with the vaccine. And she laughed and she said, I would love to meet the nurse that can pull up the serum, the vaccine, into the syringe and only get 1 microchip per shot in the vaccine. She just thought it was hilarious that people were thinking that there were microchips being inserted into people through the vaccine.
Yes, I heard something similar from a family member of mine who thought also that the microchips are being inserted for tracking purposes. And I said, you have a cell phone that you take with you everywhere. If they want to track you, that seems like there's a very easy way for them to do it without having to inject.
Right. And the thought that there could be somebody pulling up 1 microchip or whatever, right, per vaccine.
That is a great point, Donna, and one I hadn't even considered and wish I had when I had that conversation, because you're right. There's multiple doses to every vial. Truly, it would be impossible to do what they're saying.
We're only getting 1 per vaccine.
Well, thank you all for taking the poll. I appreciate your feedback. And is there any last thoughts or parting words for us this morning? If not, I hope you all enjoy the rest of your day. Thank you so much for spending some time with us this morning.
Thank you for joining us, Tip.